If you are a healthcare professional,
Yeah.
a doctor, a nurse, a therapist, and you are, staring down the barrel of a high-stakes exam for U.S. licensing or maybe an H-1B visa,
Yeah.
you know that every single detail has to be razor sharp.
Exactly.
We're not just talking about making sense. We're talking about sounding unequivocally professional, native even.
And today's deep dive, it's really like a secret weapon. We've pulled this directly from a specialized TOEFL prep guide made for this exact audience.
Okay.
We're focusing on the incredible, often overlooked power of small words. We're talking about fixed noun and preposition pairs.
The tiny words that trip everyone up.
They do, and the source material is so clear on this. It says mastering these specific linguistic patterns is the absolute quickest way to boost your fluency score. And, more importantly, to make sure you're clear in these high-stakes medical settings.
So our mission today is really targeted then. We're going to treat this information almost like a critical diagnostic.
I like that, a diagnostic.
We're going to pull out the 20-plus pairs that the guide pretty much guarantees will move your speaking score from what they bluntly call stutter to stunner.
And it's not just about the test, right? This is about equipping you with the kind of linguistic precision you need when, lives could actually be on the line.
So we're going to get into why these fixed patterns exist, because that feels like the key to unlocking it all.
Yes. Understanding the semantic role, the job of the preposition, why we use for instead of in a specific context, that's the shortcut. That's what makes these combinations feel like second nature, not just a rule you've memorized.
So let's talk about the stakes here. Where does the pressure really come in?
Well, think about a simple phrase, something like responsibility for patients. It's a core concept, right?
Absolutely, in any healthcare environment.
And the guide flags this common error of slipping into responsibility to patients. Now, to an untrained ear, it might sound okay.
Right. It sounds close enough.
But in a formal professional context, that small change, just swapping for with to, it subtly shifts the meaning. And crucially, it signals a non-native structural pattern.
Explain that difference a bit more. Responsibility for versus responsibility to.
Responsibility for implies guardianship, total accountability over the care. Responsibility to suggests a duty you owe someone, it's related, of course, but it is not the fixed expected expression.
I see.
And the graders, they're trained to spot these fixed expressions like demand for services because they are the absolute hallmarks of native-like fluency.
So the preposition isn't just a filler word. It's actually defining the relationship between the noun and the object.
It is the relationship, and it has to be fixed in professional English. I mean, think about it. In medical English, terms have to be unambiguous. A single word can differentiate a diagnosis from a differential.
So if you confuse a preposition, you're introducing ambiguity.
You're introducing ambiguity, exactly.
I love that you keep bringing it back to the test score because for so many of our listeners, that is the immediate goal. What does the data in the source say about the impact of this kind of error?
The guide is pretty stark, actually. It says 70% of low speaking scores, so anything under a 22 out of 30 are directly attributed to weak grammatical patterns.
70%. That's not just a few mistakes.
No, that's a structural problem. And it says the path to that 80-plus IBT score, which is often what you need for the state licensing boards, it relies on fixing just 5 or 6 of these core prepositional patterns.
Okay, so we're really focusing in.
Yeah, we'll focus on the big ones. The pairings with high-frequency nouns like responsibility, access, and treatment, combined with for, of, to, with, in, on, and about.
Perfect. Let's dive right into that first essential group, the one that deals with purpose and need, the for group.
Right. So nouns that are paired with for, they almost always signal a goal, a requirement, or who benefits from the action.
And the high-value nouns here are, they're the building blocks of any policy discussion.
Yeah.
Demand, responsibility, need, cure, treatment, and research.
Yes. If you can use those correctly, you instantly sound ready for any professional prompt.
So let's put them in context.
Okay, let's do it. There is a significant demand for specialized geriatric nurses in U.S. hospitals. Or maybe if you're describing a clinical role, the chief surgical resident assumes responsibility for post-operative care.
That use of for just makes it so clear. It clarifies the object of that demand or the target of the responsibility.
It does.
And the guide points out a really common mistake here, which I found fascinating. The default to using of. Why do you think so many people say demand of nurses?
It's often a direct translation issue. It's, linguistic interference from their native language. Or maybe they're confusing it with a slightly different English phrase like the needs of the patient.
Ah, I see that.
But the fixed English rule is just crystal clear. When you are talking about something that's required or requested, it is always demand for. Using of just feels clunky to a native speaker. It sounds wrong.
So if I were prepping for a policy prompt, I'd need to say something like, growing need for expanded mental health services.
Yeah.
That for it defines the aim.
Exactly right. Now, let's get into a nuance here because this one trips up even very advanced speakers.
Okay.
The difference between for and on when you're talking about academic topics.
Oh, this is a good one. The guide contracted research for cancer treatments versus research on cancer.
Yeah.
They both sound fine, but they're not interchangeable.
Not at all. They are absolutely not. When you say research for cancer treatments, you are specifically emphasizing the purpose, the goal, the desired outcome of the study.
So the research is done for the benefit of the treatment.
Precisely. But when you say research on cancer, you are just identifying the topic, the subject matter. So if a grant application asks for the goal of your study, you have to use for. If it asks for the subject, you use on.
That distinction alone is worth the price of admission. It completely shifts the meaning from just description to actual intent.
It really does.
Okay, before we move on, let's hit those bonus high-value pairs the source mentioned.
Yeah, these are great. Excellent for filling out your speaking responses. Call for help, search for symptoms, provision for emergencies, and eligibility for insurance.
Just dropping one of those in seamlessly?
Guarantees an instant bump to your fluency score.
Okay, so that for a group really nails down purpose and need. What happens when we shift to talking about targets or destinations or interaction?
That brings us perfectly to the to and with powerhouses. Let's start with to. In these fixed pairs, to almost always signals direction, or the target of the noun's action.
And the to group has some of the most critical phrases in healthcare management, right? Like access to, alternative to, resistance to.
And reaction to, exposure to. The directionality is key. If we say patients must have timely access to specialists, the word to directs that access, the ability to approach toward the specialist.
So I'm guessing a super common mistake would be access for records.
All the time. But it should be access to records because the records are the target, the destination.
Right.
To signals direction toward the goal, whereas phronesis implies the benefit or the purpose. You might have a need for access, but once you have it, it is access to the thing itself.
That makes perfect sense. Now let's look at that high-stakes example you pulled from the source about resistance. Overuse of antibiotics leads to bacterial resistance to drugs.
This is a perfect example of direction. The resistance is actively directed against or toward the drugs themselves.
Okay.
If you mistakenly say resistance from drugs, you're implying the drug is the source of the resistance, which it makes no sense clinically. The resistance is a barrier to the drug's effectiveness.
That is a critical fix. Okay, shifting gears now to the with connectors. These seem less about direction and more about, association. Direct contact.
Exactly. For with, we're focusing on three really operational managerial nouns: contact with, experience with, and compliance with.
Contact with seems pretty straightforward. Limit contact with infectious surfaces.
Right. But let's look at the other two. Experience with is essential for describing your competence. You need to show that a clinician has extensive experience with complex surgical procedures, not experience in or experience on. With implies that direct, hands-on association.
And compliance with rules or medication, that's non-negotiable in the medical field. That's an operational imperative.
Absolutely. The highest stakes example might be patient compliance with their adherence schedule is essential. The use of with here just locks in the association between the person and the rules. You can't use to or for. Compliance with is a rigid mandatory pair.
Just repeating these fixed phrases really drills home the idea that this is linguistic infrastructure. It's not just a style choice.
It's the architecture of the language.
Okay, let's move to our final set of advanced pairs. These feel critical for, detailed analysis and reporting. Let's start with nouns plus of.
Right. This group often deals with causation, risk assessment, and specific diagnostic definitions. The key nouns define negative or analytical concepts: risk of, cause of, diagnosis of, and prevention of.
And the function of here is to show what the noun is made of, what it consists of.
Exactly. The composition of the risk or the definition of the cause. So when you're presenting data, you would say, there's a high risk of post-operative infection. The risk is composed of that potential infection.
Or on a public health level, The study focused on identifying the primary cause of burnout among residents.
Perfect. The cause is the origin of the burnout.
Okay, next up, nouns plus in. This group seems to focus more on scope, on context, or measurement. The phrases are usually pretty quantitative. Increase in, improvement in, specialist in.
This is a massive area for error correction. I mean, this one trips up advanced speakers all the time. People often try to use, when they're describing a change, they'll say, improvement of health.
Wait, improvement of health? That seems almost logical, because the health is what's being improved. Why is improvement in health the only correct structure? Can you break that down for us?
Yeah, it comes down to scope. When we use in, we are defining the area or the context where that improvement is being seen.
Ah, okay.
The improvement occurs within the domain of health. If you use of, it sounds like health is a possession being improved, which is just grammatically awkward. So it's always an increase in mortality or an improvement in function. The in defines the domain.
That makes the distinction so much clearer. It's about specifying the field of activity.
Mm-hmm.
Okay, what about nouns plus on?
As we touched on with research, this group is all about focus, the subject, or the direct impact. Think research on, effect on, and focus on.
Which is vital for any academic or clinical reporting. We talk about the negative effect on patient morale from, say, a prolonged hospital stay.
And that on is so critical there. The effect is directly exerted onto the morale. The guide stresses this common error of saying effect in immunity or impact in results.
Right.
The fixed pair is always effect on or impact on because the preposition shows that direction or influence.
And finally, we have nouns plus about. This seems like maybe the simplest group. It's just signaling the topic.
It is simpler, yes, but it's essential for structured communication. You know, things like discussion about, concern about, information about. You need to ensure a department-wide briefing about the new patient intake procedures. It keeps things clear and professional.
What's really apparent now after breaking these down is how these tiny words are basically the glue holding professional meaning together.
They really are.
They're not just vocabulary, they're structural anchors.
That's a great way to put it. Let's try to pull it all together. Let's demonstrate that fluency we were talking about. Just listen to how many of these pairs we can weave into one single policy-focused scenario.
Okay, let's hear it.
Something like, assigning greater responsibility for remote monitoring addresses the high demand for specialized geriatric care. This ensures patients have improved access to specialists, reducing the risk of complications and leading to a measurable improvement in overall health outcomes. Furthermore, we must ensure patient compliance with the new medication schedules.
Wow. That's 6 high-value pairs used completely seamlessly in one focused statement. That is the sound of native fluency.
It is.
So for you, the listener, the actionable takeaway here is immediate implementation. The guide stresses that you need mechanical repetition. Create 5 full sentences every single day, focus on your own clinical area, and use these specific pairs.
That's how you do it.
That's how you shift them from being rules you have to memorize to patterns that are just their muscle memory.
And that consistent practice is key. And it's not just for the test score. It really goes far beyond that. I mean, given that the source material stresses how linguistic precision is key to professional medical communication, just consider the broader implication here. How does perfecting these seemingly minor grammatical patterns not just boost a test score, but potentially contribute to clinical accuracy and patient safety in a real-world, fast-paced healthcare setting?
I see where you're going.
When a nurse quickly needs to relay information about a patient's resistance to a drug versus their resistance from a drug, that tiny preposition ensures instant, unambiguous understanding during a critical handoff. That's the real power of precision.
A truly high-stakes deep dive. Now go